So we've been talking this month about neck pain and what can cause it. So today I want to talk about one of the treatments that we use here in the office to treat the disc problems. So we talked about the three different structures in the neck that can be causing your neck pain. One are the vertebrae themselves, or the cervical spine. Two are the muscles that support that spine, and then three are the discs that are in between the vertebrae themselves. So Blair was kind enough to be our volunteer today, and so we're going to talk about the decompression table that can help with those disc issues. But real quickly, I just want to give you a recap of what a healthy disc looks like, and then what we're trying to affect when we do mean disc issue or disc problem. So the first one I wanted to show you was a healthy disc. So the nucleus it's almost like a jelly donut. So the nucleus is the jelly of the donut. The fibers are where what are keeping the jelly in place. And as long as the joints in the spine are moving the way that they're supposed to, this will stay hydrated and full. Now, it doesn't have its own blood supply, so the way that it stays hydrated and gets the nutrition that it needs is through a process called imbibition, which is motion. So this motion in the spine is what allows these discs to stay full and healthy. So if you either get into an accident, or if that motion starts to go away and these discs starts to dehydrate, these fibers can actually start to become more brittle, and they can start to tear. If that happens, because the nucleus itself is a gelatinous material, it'll take the path of least resistance. So if these start to tear, it'll start to move towards the outside. If it gets close enough, what will happen is it'll bulge back against the nerve. That's going to start to create that pain. Because again, the only reason why you're feeling pain in your neck or anywhere else in your body is if these nerves get pressed and send that pain signal back up to the brain. So when that bulge happens, what we use here in the office is our decompression table. And the whole point of that is so the head gets strapped in here. The cord is attached to the device, and it'll just gently pull, and over a certain amount of time, so it usually takes a couple of minutes to get all the way up to the full pull, and then it'll relax and it'll come back down, pull again, come back down, pull again, come back down. So it does that. We usually do that over the course of about 15 minutes. And what that does is it starts to open and close in between the vertebrae, and that can start to create negative pressure inside of the disc. So when the inside of the disc starts to get into negative pressure, it can actually start to pull the disc back away from the nerve, giving you relief from that pain. Now, because the tears are already there, it's going to take some time for the body to start to heal itself. That's why we use things like laser and the adjustment to make sure that the underlying cause of the problem is getting addressed, as well as anything we can do to help speed up the healing process and to decrease the inflammation. So if you or anyone you know is dealing with any kind of cervical disc issues, this decompression table is a great resource for you. There's only a few offices here in Springfield that actually have it, so you want to make sure that everything is being addressed when you come in with a neck problem. Because if you're just trying to adjust the problem, or you're just trying to use laser on the problem, but the issue is actually a disc issue, until you start to address that, you're going to continue to have those problems. So if you got some value out of this, please share it. If you know someone who is maybe suffering from something like this, tag them in the comments below, and we'll see you next time.